Dr. Vijaybhasker, Masters in Orthopedics. Today we will discuss about back pain. The back has 5 lumbar vertebra. The spinal cord is formed by the lumbar vertebra, the vertebral bony tissue, with the 2 joints and a spinal cord inside the vertebra in the canal, and it gives out the 2 roots, one on left and another on right. So L4, L5, L5, S1 and sometimes L3, L4. These are the levels of the vertebral bodies where the spinal cord gives out the left and right nerve roots. So the common pain is there in most of the cases, the back pain, which rises from the L4, L5 nerve roots and sometimes central cord pains. Very rare the L3, L4 and L5, S1 also cause the pain. So what is L4, L5? Disc prolapse. The L4, L5 has a 2 bony L4 and these are the 2 bones L4 and L5. There is a disc between 2 bones which helps you to like in a shock absorber, and there are the spinal cord in the canal, and there are 2 nerve roots, one left and another is right. When these nerve roots compressed by a prolapsed disc or the burst out disc causes the radiating pain into the leg, either left or right. This is called a sciatic nerve because of the irritation at the root level will give you a radiating pain into the limb, that is called sciatica. So now you see this L4 and L5, there is a disc, which disc is having a annular ring, a round ring around the periphery, and there is a jelly type fluid or a tissue in the center. So because of the wear and tear or accidents or untoward incidences, the 2 bones compresses or puts untoward injury to the disc, leads to the bursting of annular ligament, but that's a peripheral ligament, leads to leakage of a jelly-like tissue posterior to our back, where it compresses the cord. That means this is the cord, and sometimes left or right roots, and sometimes both the roots. So that is the what we think of L4 and L5 significance is. The most common mobile part is L5, L4. So hence the disc burst or disc puncture is possibility at L4 and L5 levels, because that's the most mobile part of your body. So this disc to be needed to assess by CT, angio or MRI, sometimes a basic X-rays. When you confirm that the MRI shows the large disc protruding out and compressing the cord or roots, then accordingly we should think of. We should think that the stage 1, 2, 3, 4. When the stage 1, it's an initial pain in the back, but there is no neurological weakness. Then we can treat with the medicines, physiotherapy and bed rest. When the stage 2, there is a pain radiating into the legs, that is called sciatic pain, aggravated with a weakness, a numbness in the limbs. Then it needs again the medical treatment, physiotherapy and back support like LS corset. Then the stage 3, where the root pain is increasing either of sides or both, and there is cough impulse causing the pain on the back. That means there is a progressive neurological weakness leads to pain. So that time we might require to give a local injections, pain relievers, back rest, and then care, physiotherapy and medication. At last, at stage 4, where there is a neurological deficit is more than what the person is having, and then suffering more than 6 months, even after all the treatment the patient is not happy, then there is a progressive neurological deficit. That times we need to do a discectomy, that's a micro discectomy, or laser discectomy, or sometimes open up surgical discectomy, and that is the answer for the L4 L5 problems.